Thanks to all our invitators to be part of this first webinar that we as Transform Europe promote. We are working on the commons as a strategy for the left in order to have a special point of view of this pandemic catastrophe that we're living. And well, we start thinking about the commons as a process, of a social process that allows the population to have the particular rights to health care, education, and water, or wherever. And this is particular, in this time, particular, the point, how we face the pandemic tragedy that we live, and how to reinforce the construction of the welfare state, of the social rights, to make it stronger and capable to confront the capitalist way to solve the problem. Because we are afraid that after the pandemic, after the coronavirus, everything will slowly come back as business as usual. This is what we want to avoid. What we want to have is a different perspective, not to come back as normal as usual, because the normality was the problem that bring us in this time. So we opened this 3 webinars. This is the first of the 3 that we want to have in order to promote this point of view of the commons, facing the pandemic, the healthcare system, and how to promote the healthcare system at the global level. And we will talk today at the global level. And the next week, we will have the more focusing at Europe level. And then the third one will be about the change in the global scale of the capitalist way to accumulate value. So first of all, as Transform, I thanks again all the participants. And we also have a Q&A box, question and answer. You could put your question, and Tatiana Mutigno, that is working with me in Transform in order to facilitate this working group. We collect the question and we'll put on the table to the speakers later on. So now I give the floor to Francine Mestrum, that is helping me in this particular webinar to introduce the host and to introduce the topic that we want to address. Francine.
Thank you very much, Roberto, and very welcome to, first of all, our panelists and obviously all those who are listening to us and watching us. We have a very global panel today. So I say, first of all, good morning to Armando De Negri from Brazil. He is an epidemiologist, coordinator of the World Social Forum on Health and Social Security, and working also for the UN Human Rights Council in Latin America. I say good evening to Dinesh Abrol, who is from India, who has an impressive career in research on intellectual property and works on innovative pharmaceuticals, and who is a member of the All India People's Science Network. And I say good afternoon to Vittorio Agnoleto, who works at the State University of Milan, but we also know him from the European Parliament. We know him from the G7, G8 mobilizations in Italy, and he is currently scientific responsible for the Coronavirus Observatory in Lombardie. And as you might know, Lombardie is the region in Italy that has been very hard hit by this coronavirus. They will speak to us about different aspects of this crisis. And I first of all would like to give the floor to Armando De Negri, who will say a couple of words on Brazil, I hope, and who will say some words on the need for universal health care. Armando, you have the floor.
Okay, good evening, good afternoon, good morning for all different people from different parts that are following this talks. Of course, it's always very challenging to resume in 15 minutes what could be a kind of a global scenario for our very, very important debate around how to express and to achieve the social protection systems, and particularly in this context, the social protection to health in the middle of these pandemics, and trying to go beyond the pandemics in the sense of the deep transformations we need. Yesterday, I was reading an article of a very important Indian scholar that was talking about the fact that we never before we had been so unequal, no? In the sense that the way we face the pandemics right now demonstrate in a very large scale the level of inequality we have in the world. She was particularly interested in the aspect of the lack of economical capacity of most of the global South countries to apply a significant part of the gross national product in terms of to make face to the pandemics and to enhance the capacities of the public systems to deal with the health questions as well as the social and economical support of the people. This Professor Jayati Ghosh compared the amount of the gross national product that was invested by the United States, for instance, that authorized supplementary expenditures that are equivalent to 14% of the gross national product of the United States to face the consequences and to be able to answer to the impact of the pandemics. Japan is using more than 21% of the GNP in terms of reference value for the public actions, 10% in Australia and 8.4% in Canada. In Europe, it's not so easy because there is a lot of problem in terms of the limitation of expenditures disciplined by the European Union, even in face of the pandemics. But anyway, it represented 1.4% of the GNP in Italy, 1.6% in Spain, and 9% in Australia. So there is a diversity here. And Germany and France are 4.9% and 5%. And anyway, the effect of the European Union limits the expenditure that could be used beyond the budget limitations is anyway a problem for European countries, but it's far better than we can observe in most of the global South countries, where frequently the fact that our countries are not allowed in the South to mobilize money by the fact that we are very dependent on the translation of our economies to dollar or euro, what makes very hard to mobilize additional money. We are not able to produce more money. And in this sense, the economical limitation to the measures adopted to face pandemics are really important. I mean, and this is tremendously unequal, no? Among the countries in the world. So this deep inequality is something that is very visible now in terms of international comparison. But within the countries, the fact that most of our economies, and Brazil is a very good example, are very much indebted. I mean, the debts we have paralyzes the possibility to go beyond our regular budgetary capacity. So we are using really very reduced resources to face pandemics. I'm mentioning that as an introductory note because for me, the question of the pandemics that could be interpreted as an opportunity, a crisis opportunity to project a new perspective, no? To introduce a transformative process, including the concept of common goods. Of course, when we think about common goods, we could think immediately about how would be access to vaccines, no? In the context of the discovery of effective vaccine, or the drugs that could be effective for the large-scale treatment of a population affected by the COVID-19. And in this sense, of course, we focus our interests in these common goods for mankind around the medical, no, resources and so. But our condition previous to pandemics, it seems far away, isn't it? But it's only some months ago, was very unequal structurally, and remains unequal during the pandemics challenging, and probably will be very unequal after that, no? So the fundamental structure of our societies in terms of political power, in terms of economical condition and so, are not changing. And in many ways, what is happening that the shock produced by the pandemics has been used to make a deeper installation of the and observe, for instance, in the very symptomatic example of Brazil, is that during pandemics, social lack of protection, so the lack of protection is very aggressive. So with the reduction of the workers' rights, with a very limited amount of research to prepare our health system for these new demands around the pandemics, accumulating very old debts we have, social debts we have in terms of the deep inequalities of our society and our societies in the global south for most of the countries. So saying that, I'd like to propose a first question. If we consider the Karl Polanyi perspective about the cyclic crisis of capitalism, could we have now a new chapter where instead to have a world free market, could we adopt a much more social protective perspective for the effect of this situation of the crisis, and from there to generate a new perspective in terms of a new stage for common goods adoption, and the way it could be orienting our next stage of civilization in each country in the world. If we do this question, I'm very skeptic about the positive possibility to introduce in the global agenda a transformative perspective. Because the previous condition was, from the pandemics, it was very weak in terms of our political capacity to introduce those aspects in the agenda. No? So we are obliged to review the way we are facing the challenge we have now in terms of the strategies. No? Common goods is a very, very powerful argument, no? But it needs to be translated in a very active political incidence. No? And in this sense, what we don't have is the capacity to deal with the power correlations in civil society, in society as abroad. Because since we have a very much oriented individualistic approach to the challenge of life, and the construction of the solidarian concept of social protection, the way we are dealing with the pandemics is a very fragmented way, no? And the case of Brazil, again, is very emblematic. I mean, what we observe now in the country is a position of the federal government through the Bolsonaro presidency, saying that, no, this pandemic is not the most important. The most important question is the lack of employment, is the frailty of economy. If we stop everything in order to protect us from the virus, we'll destroy our social life and our economical capacities. No? So in this sense, we need to change the strategy. That is what they are saying that, well, let's go ahead, let's go to work. Otherwise, you have no food to eat, you have no jobs, none preserved, and the crisis will be deeper and deeper. And by the other hand, we call from public health perspective that the solution now would be a much more solidarian perspective, in the sense to protect people from the virus through medical and sanitary actions, as well as a much more social protected policies, social protection policies that could preserve the economical and the social capacity of the people during this period of pandemics. That probably will be very, very long period. No, it's not something for months. As we are facing now in Europe, the fear of a new wave of the pandemics and the instability of that demands a very, very strong process of reorganization of our social and economical protections, and the review of the fundamentals of our economical organization. No? The re-embedment of economy in social life, in social needs, is extremely important. But unhappily, we don't have power enough, politically speaking, to transform that. I'm not very, very sure if the speeches of the president of France, Macron, reviewing his position in face of the social solidarity and social protection will be really translated in a new perspective for France, no? The population, for instance, or even the premier of UK, no, saying that now he understands the importance of the NHS, no, how it's important to have a public system, and so. So these very emotional declarations now, I don't know if they can sustain that. Since the financial powers behind all those global dynamics are not really affected by the pandemics. They are always empowering themselves in a much higher level in this kind of perspective of the way we are dealing with the pandemics. So the structural inequalities that could be really faced through a common goods perspective within a broader framework of social and human rights perspective that could enhance our interest on the right to development as a kind of a sovereignty project of the nations in a very much a fair relationship in terms of international cooperation, is something that we need to achieve anyway. So when people now realize that they need public health systems to face the impact of the pandemics, but not only that, to face all the unequal perspectives of life in societies that are guided by the profit and guided by the privatization. So this realization could be for a long-standing reference to transform really the health systems and health in a non-commodity perspective, no? To break this fictitious commodity in terms of Kaupalani, this fictitious commodity that was transformed health and social protections, and to face the recent strategical moves of the capital asking for the financialization of all social policies, no? That is very spread, for instance, in case of health, in this flag of the universal health coverage, no? Introducing a dynamics of insurance sustained by state research, but dealing with the mechanisms of market, no? To expand the coverage, but not going through a social justice perspective. So this scenario that was going on before the pandemics, and that's not changing during the pandemics, and probably will be the follow-up of the pandemics during this large period of pandemics effects that probably will be present for us till 2024, I believe, is something that is very, well, very tricky. If we remember the definition of Naomi Klein about the shock policies, no, the shock syndrome, they are using the shock of the pandemics to go deeper, as I mentioned before, in the neoliberal perspective, no, in the conservative political projects. So this very complex phenomena of the pandemic's effect on social and economical life will be probably very present in our lives from now to the future, at least for the next years. And we need to change our strategy, no? Change our strategy in order to be much more effective. How to translate this whole approach of all the dimensions of political, social, and economical challenge in a project of transformation that could be able to dialogue with the need of the people to be protected from the pandemics, but much more beyond that in terms of social protections. So if we use the common goods perspective to think about systems, no? Public systems, universal systems that could be understood as common goods, it represents the challenge to recover the historical reference. Maybe in the case of Europe, to think about the welfare states, no, and all that was the challenge of those welfare states during all this period, especially after the crisis of the 70s. And now in the global south, where we never had a full experience of welfare states, and we always have a fragmented, no, social protection systems, very much limited by the fact that we never had salary societies. And so we always had a very important and have very important informal participation of the workers in the economy. No? So in this sense, if we are not able to translate this in a project that could be understood by the population, no? In making the counterpoint to the individualistic, very much sometimes theosophic approach, in the sense to generate now this understanding that through God I will have the happiness, and if I do my individual effort I can achieve that, if you give me conditions for competition, no, and not thinking about the solidarian project.
Two more minutes, Armando. Thank you.
In this sense, this tension that is installed, this is the hegemonic process going on now. If we are not able to present something that people can believe that's possible to achieve, and transforming the very diverse but fragmented initiatives of solidarity in society now to face the pandemics in the absence of a strong presence of the state. So if we're not able to translate this perspective, it will be in a very effective political action. I think we won't be able to install a new reference, no, of social protection systems as a common good that we need necessarily to transform society, no? To transform the full dimension of economical order and the social order and political order. So in this sense, I think we need to be very aware of the danger to propose things that finally will manage the order, no? In order to make the rupture of the order. Those times are times for revolutions, no? Times of the deep breakdown in the concept, no? In the concept, because the first problem we have is in our head. So when we think about pandemics, there's something that we'll deal with the same tools, with the same perspective we have, no? and attention, we have strong ideas, but the transformation in these ideas in the thinking of societies, creating a new future image, no, is something that's very challenged now how to make it. And in this sense, we are frequently captured by the idea to talk among our friends, no, to talk in our bubble, no? And the difficulty to translate this in something that could be accepted by the majority of society is very challenging. And when we consider what is the phenomena is happening in Brazil, that's very similar to what is happening in United States, in the sense that you have a very right populist perspectives, not to answer to the need of part of the people that will act in favor of the government, and to be able to constrain the other parts of societies in terms to project a very fearing message in a certain way, but dealing with the very immediate aspirations of society through fake news, through whatever you want, but dealing with a deep dialogue with the aspirations and fears of people, no? So if we are not able to propose another perspective in this sense, it'll be very hard to go beyond this crisis, transforming this in our crisis perspective, no? Since 2008, we are dealing with the crisis of the financial capital, and I will conclude. And in this sense, it's time to project our crisis, no? The democratic crisis, the social crisis, the environmental crisis, and to answer through perspectives that is common goods, very powerful perspective, adopting a new idea for the future, no? So it is necessary to be able to answer to the concrete needs and aspirations of the people. Otherwise, it will be very, very hard to place a common goods perspective or a broader society project, Solidarium project in the agenda for the next years. So I think it's not a very optimistic perspective, but I think we need to face the reality as it is now in order to cross this very challenging times with a much more stronger perspective. Thank you.
Thank you very much, Armando. So what your main message is, if I understood correctly, is that there is a strong need for more solidarity in society, that humans have to be put above the economy, and that we need to change our strategies and our perspectives if we want to overcome this crisis. Thank you so very much. I will give the floor now to Vittorio, please.
Okay. Good afternoon, everybody, and good morning to Armando. All right. So I am speaking in Milan, that is the capital of Lombardie. That is the region in Europe that is more involved in the tragedy of COVID-19. So, in a globalized world, it was not difficult to predict that coronavirus would also arrive in Italy, in Europe, and in Lombardie, the region most inserted in the international route. But there was a window of opportunity. That is the term used by WHO between the discovery of the virus in China and its appearance in the West. The window of opportunity was a formidable opportunity to better organize the response to the virus by avoiding finding ourselves unprepared. But the reality was completely different. Our authority didn't do anything to prepare the people to resist to virus. a health system that was focused only on care and profit, which has transformed health in a commodity, which ignores prevention because it doesn't produce profits for the private lobbies of the sector, and which doesn't involve the population in the protection of their individual and collective health, shows his Achilles heel in front of a new infectious disease of easy transmission. These deficits are not random or are not limited to coronavirus affair. The problem is that we are in front of a strong contradiction, because nowadays in Lombardie there is the possibility to being cured with the best therapy available in the world, of being operated by teams with top-level professionalism. But in the same time, prevention services are reduced to a minimum. First aid almost at all are in highly critical conditions. General practitioners are in a short supply. Territorial clinics are reduced in number month after month. So, the COVID emergency showed to the eyes in all the world the total disaster of our health system, of the system of Lombardie. We cannot to have a different opinion about this. I would like to remember that at the 1st of May, we had about 30,000 dead in Italy, but the half of these now are more than 15,000 of deaths are in Lombardy. And the Lombardy has a population a little more 10 million of people. This means that we have about 155 deaths on 100,000 inhabitants, people. So it's a very, very strong impact. But everybody in Italy and in Europe, when they spoke about Lombardy health system, everybody said is excellent. We receive people to cure from a lot of different parts of Europe. The problem is that the high level to cure, the high level of surgeon intervention are completely different from the territorial health system. So I think that there are three most important reasons about this situation. The first one is that we have a mixed health system. That does mean with together public system, a private system inside the public system. To give you an idea, the 40% of the public money of Lombardy to the health system, the 30% is for the private structure inside the public system. So it's clear that it is not an interest of a private structure to work about prevention. It's not only not their interest, but is against their interest, because if we are working very well about prevention, there are less illness, less people with ill, and so they have less clients, because they use the word clients in their hospital. So the private has no interest in the prevention, and so they are against prevention. Another reason is, inside this first chapter, is that the private system is not interested on first aid, on emergency department. They like to work only about chronic disease, cardiology, and high-level surgeon intervention, because they can reach most profits from this sector. So this is the first chapter. The second chapter of our disaster is that the government of Lombardie, that is a right government by more than 20 years, decide to use the same idea and the same item, the same principles inside the private sector, to use the same inside the public system. I can do an example. In our country is the government, the regional government, who must decide who are the general director of our territorial health structure system. So they decide with a political link, but they decide also to look if there is an economic budget, and they analyze the economic budget in the same way how you must analyze a budget of the private manufacturer, private workplace, without any difference. They don't analyze, for example, efficacy of the health system. They don't analyze either the people wait 1 day or 1 year to book a visit. So they use the same indicator, the same point that normally are used to evaluate the private sector. And for example, inside the public sector, they built a lot of hospitals, but they destroy completely the territorial health system of the National Health Service. They close a lot of ambulatory on the territory, and they close some general hospital in the same territory where the private are building a new hospital. Okay, this is the second chapter. The third chapter is, I think, a more general point of view, and I think that for our interest is very, very important. I think that now is completely necessary to change our idea about health, about cure. Until now, the West country organized the health system around hospital, around only the cure of the ill, around a medicine with a lot of specialization. Now every doctor is able to cure only a little part of our body. We are going to a personalized medicine about genome and so on. But this medicine is a medicine that in the future could be only for a little number of persons, a little number who are able to pay. Now the situation is different. I think that in the future, the next dangerous situation will depend on virus, on infectious disease. So we need to change our mentality about health system and about idea of the health. we need to go back 1948 at the first idea of WHO, with the WHO said that we must evaluate our situation not only if we have not ill, but how we feel in the social, psychological, cultural, economic situation. It's necessary to spend more money about territorial health system, about prevention, about the capacity to monitor if other ill are arrived. The future of the health system will be in the public health system. I don't think we will be able to cure everybody in a personalized way, to cure everybody in his genome. It will be too much expensive. We need to avoid infection. We need to avoid that the people will be ill. Also because our system will produce a lot of other infectious disease. We destroy nature, we destroy forest, we use hydrocarbons. So if we are not able to change this system, it's clear that the new ill will arrive from this virus, because there will be a strong contact between a human being and animals. So all the situation is changing. Some our words about our situation. Our situation was terrible also because our governor was thinking only to money to private sector. And for example, they didn't buy and didn't prepare masks to avoid contact. They didn't buy a new dress for, I don't remember the name, the new dress for medical doctor to change when you are in contact with infectious disease. Or for example, there was no course about how to prevent contact with infectious disease during visit. That is a guideline of WHO. You must think that now we have in Italy more than 200 medical doctors died for coronavirus, and we have thousands and thousands and thousands, about 12,000 medical doctors and nurses infected by coronavirus. This means that not only during the coronavirus epidemic situation, but before, there was no attention to prevention and no attention only about workplace. Now we are in the second phase. We open again the workplace, but where are the health instructors with control? What has happened now inside the workplace? Is inside the workplace there is a distance, there is a mask or not? Nobody control, because the workplace health structure are destroyed, because all the medicine about workplace now in a private sector. Formerly, the public system would have only to control, but they have no people to control. At the end, some last reflection.
Yes, please.
The first,
one more minute, if possible.
3 things, quickly, okay? The first one is necessary to change also that the trade unions change their idea. Not only in Italy, but in a lot of West countries, the biggest trade union put inside the collective agreement, put inside private insurance. And this is a disaster, because automatically millions of people pass to private insurance inside the health system. We need to convince the trade unions to put private assurance outside the collective agreement. The second thing is on the world way. We need to say that health is one of the fundamental common goods, and so must be in the first place. What does it mean? For example, it is necessary to organize an international movement to change TRIPS agreement, because if in the next month we will have drugs, we will have vaccine, the problem is who will be able to use this, who will produce this, how much will be the cost about this, and the last but not least thing, is another political problem. And in Italy, we are an example, but it's not only for Italy. In Italy, for almost 2 months, we had to stay home, closed inside home, without go out. We can go out only until 3 days ago, only to buy food and only to go at system. We can organize no demonstration, no discussions. Okay, we can use also only web. I fear that the right party are working to say to protect everybody is necessary to cut some very, very important freedom. We must pay attention also about this situation in the next future. Thank you very much.
Thank you so very much. Thank you so very much, Vittorio. So this was an appeal to work more towards public health systems, take care of prevention, and for a couple of important changes, such as change of the TRIPS agreement. And maybe that is something that Dinesh may also talk about, or at least I think he will speak on these matters of intellectual property. You have the floor, Dinesh. We don't hear you.
Okay, I can.
Okay,
No.
Thank you.
Thank you. I have unmuted myself. Thanks, everybody here, for inviting a friend from Asia, India. And I've been asked to, prioritize the issue of vaccines and pharma, and I agree to do that. Though there are many other issues which have been raised by Negri and many of you, then maybe we will take them up later in our discussion. Let me start with the issue that everybody is waiting for a miracle bullet called vaccine, and we know antiviral vaccines have not been very easy to, bring into the world. Because we know the case of HIV, it still does not have a vaccine because it mutates very fast. Unlike, antibiotics also, though there is a resistance at there, but these viruses which are mutating very fast do not easily, become amenable to universal vaccines that we can put into our health systems. Though it's not impossible, vaccines can be produced, but those vaccines themselves will have to undergo change time to time. So public sector and hospital system and the whole healthcare system, which generates data as well as sequences on which we will build our vaccines, would have to be made accessible to the researchers as well as industrial entities which would multiply those vaccines subsequently. So it's important that the way we organize our healthcare research and development and innovation linkages, that's quite critical. Now, having said that, yes, what the challenge is involved in case of vaccines, let me start with linking what I have to say with regard to vaccines with what Negri or Agnoletto have already brought in. See, both Negri and Agnoletto are pointing out to how the neoliberal reforms which the private sector, the transnational capital pushed for, in our countries through the nation states, and we were subject to those reforms to which attention was drawn in overall terms by Negri and by Agnoletto in the context of health system, in particular in Lombardie. I would take forward that particular narrative into vaccine production, and see, vaccine production and development has been one of the India's strengths for over a century. In fact, 1896, 1897, we began to establish institutions which were working on vaccine production. We were a colony at that particular point of time. There were several institutions set up, though for protecting British Army more than really the Indian people at that particular point of time. But in the post-independence period, when India became liberated, many of those particular institutions served us well in terms of producing essential universal vaccines. And as a result, even now, some of the vaccines which are given to children, they were produced in these particular places, or even the polio vaccine, or vaccine against measles, or vaccine against very many outbreaks that which we are well aware of, which Europe in fact got over quite some time back. We had to get over them, even whether it is with regard to even plague, smallpox, and so on, etc. One can start talking of that. These vaccines were produced in public sector, and these were public sector entities created during the British time and maintained and developed during the post-independence period. By the 1980s, when India began to implement these neoliberal reforms, these institutions were undermined. We had to fight a big battle in the mid-90s, late 90s, to see that these institutions don't close down. In 2012, we had to actually go to Supreme Court, and we had to run a big public campaign to ensure that these public sector enterprises, which used to do research as well as produce vaccines, remain alive and kicking. These are more than 6 institutions distributed all over the country. I don't need to spell out their names in details, but what I want to indicate, why they were being closed for? They were being closed because we needed to actually upgrade our general manufacturing practices, the GMP in those particular places. The investment had to be made, and was required to be undertaken, but the state was not willing to undertake that particular investment because it was wedded to Washington Consensus. It was wedded to provisioning that public sector state must get out of production altogether. This should be left to the private sector. So is the case that they were doing with regard to the healthcare system as well. But I'm really talking about the moment vaccine production. In fact, 80% of today's vaccines in India are produced in the private sector. Serum Institute, which is one of the partner of the Oxford effort with regard to the COVID vaccine, is one of the largest producer in the country. It's located in Pune, very close to Maharashtra. It's in part of Maharashtra. Serum Institute, there are many more private sector entities, and there are many more private sector entities now than they were ever earlier in India, and they produce 80% of the vaccine. Now, Serum Institute has closed down production in order to of other vaccines, in order to actually create capacity for this COVID-19 vaccine, which is still under trial, which is not even yet gone through more than phase 1 trial. We do not know whether it will succeed or not, but they have closed the production lines for the other vaccine. The point which Agnoletto was making with regard to what private sector, when they make market calculations, they look for what kind of production or priorities which we need to promote, and that's what it's evident even in the case of where preventative objectives are supposed to be served by vaccines. It's not actually chronic diseases being served by them necessarily. It is dealing with infectious diseases, outbreak of infectious diseases. But even within that, if you see what the objectives are, what kind of challenges that we face, how the private sector deals with it. In fact, if you start looking at the vaccine challenge, it's one of the most difficult challenge. Unlike single molecule drugs, therapeutics with which we are used to, where, but even there were huge amount of difficulties, as we know, that India had to produce them by changing its Patent Act. The Patent Act of 1911, which the British had given, had made India totally dependent on production of drugs on transnational corporations. And British transnational corporations at that particular point of time. I remember when the TRIPS agreement battle was on and Brazil was involved. Italy was also one of our, always an example, because it used to have local production of Italy, and its pharmaceutical industry was fairly strong, and we used to invite the pharmaceutical industry representatives from Italy to join our conferences when we were actually battling out the TRIPS agreement to which Agnoletto referred in his last remark. Now, the TRIPS agreement, was based on the understanding that that information is, or the knowledge for drugs and vaccines is difficult to produce. Once it is produced, it will be very cheap to reproduce it, though that is really not the case. Development of absorptive capacity or system building is a very costly exercise. And particularly if you want to meet the public health needs of whatever type, whether it is of infectious diseases related therapeutics, or whether it is with regard to new lifestyle diseases, the non-communicable diseases about which we now also are suffering, apart from diabetes, obesity, and so on, etc., which are virtually like epidemics as far as global South is concerned, and India is one very bad example of double burden now, which is Indian people are suffering from. Now, when generic pharma was becoming a competitor for the United States and many other European even pharmaceutical industries, they tried to bring in the 1980s the TRIPS agreement. The TRIPS agreement, was dealing with the, with regard to medicines particularly, and I think overall information, once produced, no doubt, cannot exclude others, because once it is number one, it's not easy to exclude from information, and second, it's a non-rivalrous, element. Meaning, once it is shared, it is not depleted. It's not like a pizza which you turn it, if you slice into, say, into 3 slices, 4 people cannot have it. But as far as knowledge is concerned, when it is shared, it actually multiplies. It actually grows, and it actually has properties of fungibility. It can be converted into many new products, and that's what we've seen. Even in the case of COVID-19, many of the products that we are today trying to immediately bring into the world of healthcare system, they are being repurposed. More than 66 products which are today out of the 100 plus products are basically already available, repurposed. Let me give you an example of remdesivir, which was actually sought to be developed in the in the case of Ebola, but it didn't really succeed very well in the case of even Ebola, and now is sought to be repurposed by Gilead. And the Gilead has already roped in Indian firms again. There are I think 6 of them, if I'm not wrong. These firms have been given voluntary licenses, VLs. The TRIPS agreement had in the flexibilities what was known as a compulsory licenses as well. I'm sure many of you are familiar with that the states can actually, nation states can use in order to improve access to vaccines or to therapeutics to their local populations through using CL, but they do not want compulsory licenses. Precisely, they want voluntary licenses, because then they can enter into agreements on where it should be produced, how much it should be produced, how it should be priced, so that they don't become actually universally available. And precisely the challenge of whether therapeutics or vaccines is going to be that they are firstly, whether they will be produced or not, and I'll come to that. What are the barriers that how IP creates, intellectual property can create barriers to the product development itself of many of these therapeutics and vaccines. But the challenge that even if they are developed, and I hope if they are safe, and I hope they are appropriate, and I hope there is a system to actually, keep addressing the question of, because COVID virus is going to mutate hugely as far as it's concerned. It is very prone to errors. When it copies itself into its proofreading, when it is done, it changes. And once it changes, then new strains are produced, and that's why there are so many strains floating around in the world at the moment. And if vaccines are to be developed, we'll have to keep really ramping up our production and development of vaccine capacity right through. That would be the case, and hospitals and the industry and the academic institutions will have to work together, and that sharing mechanisms are very, very important. Cooperation and collaboration is very important. You take the case of H1N1 or H5N1. These are all, avian flu, and you're familiar with influenza. These were, it's not that the COVID is, all of a sudden hitting us and, as if we didn't have any knowledge of it, we were not alerted. In fact, in the last decade or so, we have been hit by SARS virus or MERS virus a number of times in different parts. The only thing is that they didn't become pandemic in the way the COVID-19 has become, but they were also epidemics of huge scale. But the lessons were not learned. And if you look at the way the big pharma actually responded to that as soon as the epidemic comes, whether it was H5N1 or whether it was H1N1, immediately their effort goes up. Like in the case of COVID-19 also goes up. But once that subsides, again, investment stops in those particular areas. Because these are areas precisely where the governments are the buyers, and it is not that in the market that they can go and charge any particular price. So, and plus, because we, like in the case of chronic, as Agnoletto mentioned, that the private sector is deeply interested because you can continue to make profits out of cancer, out of various other chronic diseases on a long-term basis. But epidemics don't necessarily, are that kind of challenge. They are very different kind of challenges. Given the nature of challenge, the IP system fails altogether. And IP system, and the produce these vaccines, which are biologics, and there are so many elements into it that so many intellectual property barriers can be created. Even now, there are examples in the case of COVID-19. We've seen not only companies misbehaving, but even the whole nation states behaving. The Trump, the US president asking, a firm from Germany to shift itself to, United States, all its research and development and production, and say then you will not make this vaccine available to anybody else as far as it's concerned. We will decide how to go about it. So see, this is a challenge at the level of collaboration, cooperation. Though it's not the case that efforts have not been made in the case of WHO. In fact, right through in the last decade, after the TRIPS agreement, thanks to the social activism, thanks to the left all over the world, both in Europe. And my first visit to Brussels, when I went on the TRIPS agreement, I didn't find too many activists. I was the co-convener of the National Working Group on Patent Laws at that particular time, and I was arrested inside the hall where the Dunkel draft was being negotiated. And Mr. S.P. Shukla, who used to be the GATT ambassador at that particular point of time, was kind enough to get me out of the Brussels police hand as far as at that time. Why I mentioned that today the social activism and the social movements have grown. The left left took note of it, both in Europe as well as, because at that time, left in Europe wasn't really, looking at globalization as imperialist globalization or neoliberal globalization, whereas the countries from the south were clearly looking at it as a TRIPS was part of the imperialist globalization. So I think the larger issue which De Negri rose with is very much relevant into our discussions, and I hope through the question answer session and the discussion we will come back to this particular issue later. But I hope I have some more time and I want to make a few more points. How much time do we have, Francine?
One more minute.
One more minute, fine. 1 more minute is a lot. Let me just make the point that what is the way out? What's the way forward as far as this is concerned? As I mentioned to you that during the last 1 decade, we have actually, through social activism and movements, tried proposing that the R&D model needs to be changed. The research and development and innovation model cannot remain embedded in IP. It needs to be embedded into the common goods perspective, so that collaboration, sharing, and access and affordability and availability of proper vaccines which are needed, which meet public health needs, vaccines which, I was mentioning to you about Indian experience as far as it's concerned. We now have a number of combination vaccines, which pentavalent vaccines, which private companies want to sell, whether people need it or not, for those 5 vaccines to combine together or not, but they are fed into, and the vaccines can have side effects. Remember that as far as it's concerned. So inappropriate, safe vaccines products are the challenge. So the TRIPS agreement, R&D model, that which in 2008, which we tried pushing into the WHO, the Global Strategy of Plan of Action on Public Health, Innovation and Intellectual Property was adopted on the basis of the Commission of Intellectual Property and Innovation, which was set up in the UK with Dr. Mashelkar as his chairperson from my boss, in India, in my Council of Scientific and Industrial Research, from where I retired, and I used to have always differences with him on the way the intellectual property he was looking at and the way we needed to look at it at that particular point of time. But then a part of it rubbed on him, and then in the CIPIH at least an understanding was built that we need an alternative to the TRIPS agreement, because the TRIPS agreement embedded R&D model cannot serve our needs. We needed the GSPOA. We needed a convention, treaty, where the nation states commit themselves. In our case, you see the investment in health R&D, biomedical R&D, continuously declined during the last 3 decades, and particularly during the last 1 decade. So is the case with Big Pharma. I can give you examples on how much the vaccine patenting grows in 2 years and then it declines. And how new candidates disappear altogether. They're never put into any clinical trial. So see, you need a very different commitment, different R&D model, which allows sharing distributions, allows access, and capacity is built into production, industrial production. We have fortunately 6 or 7 firms from the pre-liberalization period legacy, which was started in the 1980s, precisely the product of a anti-imperialist agreement, model for dealing with intellectual property, which was built into itself public interest obligations of the firms, as well as the nation states were given certain rights through compulsory licensing. There are a variety of compulsory licenses. I don't want to get into details. And in fact, one license which I think the world would need even now at that particular, that's an automatic license of right, which is embedded in a liability regime, which means that you can use any intellectual property and later pay just 4% royalty on it. In fact, during the COVID-19 period, so that there is really no litigation, there are no barriers. And this Indian Patent Act 1970 used to have this license inbuilt into it, and we used it precisely for development of Indian drugs pharmaceutical industry. We are called now the pharmacy of the world, but even there is a lot of my work which you can read how during the period of last 3 decades it has changed, and it has changed for the worse and not for the better. Thank you very much. I think I'll take on later more issues. 1 minute, I hope I've used it to make the last point. What's the way forward?
Thank you so very much. This was indeed a very, very interesting contribution, and I think the 3 speakers were very complimentary. They all focused on the importance of public systems, and they all focused on the importance of the change that we will need. And I'm very glad that Dinesh always also pointed to the fact that we need to cooperate internationally, and that social mobilization is so very important. So, thank you so very much. We're now to the questions and answers.
Yes, I see the two questions, maybe just to one, it's about to go behind the multilateral system of Westphalia and open omnilateralism with the civil society to introduce precaution and common goods from local to global governance. How can we face the double aspect, the multilateral, national, multilateral, and how to improve the civil society involvement in the construction of the global governance? This is the first. I put also the second one. How do the alternative therapies, such as the use of Ayurvedic, India's traditional medicine, come to play in the treatment of the COVID-19 in India? And for this, of course, would be a question to Dinesh. And for Vittorio and Armando, what example can you give on how we, as health activists, can operate in campaign for public health as a common good in a very translatable and acceptable manner? What kind of campaigns we can improve? So it's up to you to decide. Maybe Armando, you go first, so we keep the line.
Okay. Well, let's comment in general the two questions. First of all, I think more than campaigns, our problem is how to sustain a process during time to achieve a more strategical transformation. No? So in this sense, of course, it is difficult to generalize. Each country, we need to look for the specific context to understand the opportunities we have in terms of political struggle. You know? For instance, here in Latin America, there are particular situations. For instance, in Peru, the president of Peru that stay talking with society every day around noon, he produced a dialogue explaining what's happening in the country and so on. And he was very provocative, saying that in order to face the pandemics and go beyond that, was necessary to transform the health system in a more integrated public health system. No? So this message was then translated in a different agenda in the Peruvian parliament and the social movements, opening the possibility to struggle to shape this future health system, no, in social protection system, learning from the pandemics how to go beyond the limits of a very fragmented and privatized system in many ways. So in this sense, the Peruvian condition asked for immediately very ambitious project able to fulfill this opportunity that was opened by the president of the Republic. By other hand, in the case of Paraguay, using the pandemic period, the Paraguay government is proposing a fragmented reform. I mean, a kind of introduction of private interests in a new public system, no? So it's a paradox, no? So in the sense that we can use the context for different interests on that. Consider the interests of the people that are fighting for the right to health. It's necessary to understand what is the real architecture of the process we need to strengthen. And in this sense, something that is very interesting for me is to make visible for society that the needs of society are much bigger than the answers of the state. No? That is almost the general formula in all countries of the global south. I mean, what is now very visible is that our public health structure is smaller than the social needs. Using the indicator of the hospital beds per 1,000 population, for instance, when we observe the global south, we have less than 30% of the hospital beds you have in the European Union or is existing in the North America or in Australia or in Japan or in South Korea, whatever. No? China is a very specific condition because they improved a lot the number of hospital beds in the last 20 years. No? And when we compare this very huge difference between the public infrastructure in our countries compared with the infrastructure of the universal systems, no? Even when they were very much limited in the last 2 or 3 decades, as Vittorio mentioned in many aspects of the inner privatization of the public system in Italy and so, but even with that, the difference between the global south and the north is very important. And as Dinesh mentioned, during a long time, our health systems were shaped in a colonial or post-colonial reality where the interest to take care of the whole population of our southern countries wasn't in the agenda. The agenda was take care of the people that was economically important for the projects of the colonial or neo-colonial policies, no? I mean, the strategical economical sectors, no? So this divide between formal workers linked to strategical sectors, no? And the others of the population that are a kind of disposable population is very clear now when you see the public capacities to deal with that. So maybe one formula that is very provocative to make visible for population the nature of the political struggle is to define the size of the system, the public system that is necessary to take care of the needs of the people, and transform this concrete argument to expand a universal way to deal with that in the context of possible reforms and the challenging, the way economy is organized to sustain that. What means tax justice, what means to improve the economical support to universal health systems and social protection systems through the general taxation of society, especially in the case of the financial capital, the way to definancialize now all the social policies now and transform this in non-insurance mediated systems in our societies and so. So this is a possibility to make a visible political agenda translated into a very concrete access of people and quality of access for people. Because we have now a case in our hands. I mean, when we have no hospital care, when we have no intensive care, when we have no primary health care network to deal with the epidemiological control and to keep the care of all pathologies and not only the COVID. So when we see this, what we call the planet lack of assistance that we are facing historically, because what happens that our systems are not shaped for the whole population, only for part of the population. And then the state become not a duty bearer, but become a kind of humanitarian state, acting only when there is a very big disastrous situation, ignoring the previous low-level disastrous situation that we face every day before the pandemics. So denaturalize that and make much more visible, the challenge we have. It is a matter of political communication, It's a matter of how to transform this in initiatives. Here in Brazil, we are now looking for 2 very important initiatives. One, through the parliament, introducing laws that could denaturalize this into lack of assistance, no? Establishing new reference for the number of facilities we need, the amount of money we need. By other hand, we organized a national campaign around to have only one line to have access to all public and private hospital beds. No, I mean, universal health system access at the same time integrating the resources of the private sector that's not linked with the universal system, that is linked with the private insurance market, no? Composing a unique line, I mean, integrated line, in order to make justice in this very particular pandemic crisis. But with the idea to transform this in the general discipline of our future national health system, integrating all the research to make possible to take care of everyone, non-related the condition to be taken care with their economical capacity. So in this sense is a kind of new stage of our universal health system, asking for this integrated control of all the resources, no? In order to make health really a universal right. So those are things that we need to compose and understand in each reality. But essentially, what we need to do is to move our agenda to a much more ambitious agenda, the holiness, no, of the systems, and face finally something that Polanyi wrote in the 1932 when he comments the opposition between economy and democracy. I mean, in that moment, he identified, no, the liberal economy as an enemy of democracy, since it affected the equality that all democratic regime must provide, so must produce. So in this sense, we need to look with a lot of criticism the way economical order is established and to denounce this deep inequality. Thank you.
May I say something?
Yes, please.
Okay. So, about we can organize a civil society. I explain what we are doing. So you know that Francine said that at the beginning, I work with Medicina Democratica, that is one of the biggest association about health and rights in Italy. With other association together, we organize a petition about Lombardie. We have had 80,000 signatures to ask to central government to send a commissar to change the responsibility of the health of the region, because he was a responsible of the terrible situation and a lot of people died. So a public petition. From today, we will go around with this, with so is this is a black piece of sweet. That means solidarity with the people died, but means also regional government go home, because we are responsible. On the other side, on the national level, in the weeks of emergency, we organize a national coordination about health, and we have the okay from a lot of different associations, and also from by some different big trade unions. It's not easy, because everybody knows that inside the leftish group there is always a problem. I have the first, you have the second, and so on. No, the emergence made a miracle, and now we are working together about a platform in a different study group. On the European level, with Medicina Democratica, we are a part of a international network against the commercialization of health. And we have a discussion with some maps and with the European institution. My idea is that we need to have a European health system. Is not a good thing that now we have a different health system for every country, because there is a concurrence and because the private power is only one. So they speak the same language with Italy, with Austria, with French, with Germany. We need to fight together. We need to have only one health system with the same rights inside all European Union. But there is also an international level. And so I speak with directly with Francine and with Armando, that are our stars in the international fight to defend the right for health. We need some real international campaign. And I listen what Abrol, our Indian colleague, said. We need to organize an international campaign to change TRIPS agreement. We cannot support for our years that the big pharma can decide how to do about drugs, how to do about vaccine. We need to build links and international alliance between international network of NGO association and some government of the south, or means out of the West country, okay? Maybe some also West country government, maybe Portugal, I don't know, to arrive on the table all of WTO to say, now we need to discuss about change this. And on the other side, when I hope will be possible another time to organize a big meeting, the big international meeting, I think then the item of the health, of the social protection, of the social commons must be in the first point of the agenda of all our movement and also inside the social forum. And we need to organize a new edition of the social forum about health and social argument, because I think that is one of the most important human rights, and is also a point about which is easiest to organize a common response. We know very well that discuss about this means discuss about the production, about the democracy, about the future of energy, because there is a strong link between these items and health. And we must take our part from health. I think that it's important to say this, because nobody is able to fight and to win alone. Only one example, I was in the last one, I was invited from Francine, from International Network in Philippines 1 year ago, more or less. And it was very interesting, because when I was in Philippines, I discovered that on the other part of the world, some big private power, for example, Sanofi, was organizing the same disaster. They didn't respect the rules about the trials on vaccine and so on. And they do this in Philippines, not in Europe, but the Sanofi is a European big pharma industry, okay? So we must work together for the next year, but we must begin immediately.
Thank you so very much. Dinesh, can you give another brief answer? In fact, our time is up, but please do answer the questions.
Yeah, it should be brief, and I think we began at 6:30, and 1.5 hours was the boundary that we had set for ourselves, and I suppose we are closing to that already. So there are queries relating to one on the role Ayurveda, that's a traditional medicine, can play. You know, traditional medicine in India, particularly Ayurveda, Unani, Siddha, these are three systems apart from homeopathy, which are considered part of the Ayush ministry, which deals with traditional medicine. Allopathic medicine is dealt by Ministry of Health and Family Welfare, a separate ministry. Now, Ayush ministry at the moment, has been able to offer very simple ideas with regard to, the way one can try build some amount of immunity, some amount of preventive efforts. You take hot water, there are some traditional herbs which you can take if your sore throat is there, or, running nose is there, or you have some fever, in all the systems we have some kind of palliative solutions. But they are not enough to deal with COVID-19 as far as is concerned. There is another level at which Ayurveda can be used. Some of the herbs have been, after all, more than 60% of the allopathic medical products have come from the natural products. You remember that as far as is concerned, whether it was to deal with whether chloroquine or whether it is, almost they were synthesized, but they were more than close to 60% of the product have come from natural products, and then active ingredients are isolated and then they are produced and multiplied and so on, etc. So there are four such phytochemicals which are being today now put into clinical trials. We do not know as yet what activity they would show, and depending on that, then only decision can be taken how traditional medicine can be used. I can go on with regard to there are Siddha systems also. I have a friend who works very closely with me on the finance sector, financialization and all these liberal reforms, intellectual property reforms are all interlinked challenges. And say public sector campaign is what we from the civil society have been doing. So he's been writing to me saying there are two formulations in Siddha which should be actually what is called Nilavamo Bimbu Kudanir, which actually help prevent the chicken quinia at that time. And so he said, why not we test it in this case? So has been referred to the NIV. Like that, there are suggestions coming there for us. There are a number of debates with regard to Ayurveda, traditional knowledge, digital library, what role it played vis-a-vis the TRIPS agreement, and so on, etc. Could we prevent patents being taken by big pharma on some of our natural products and on our Ayurveda formulations and so on, etc. I don't want to get into that particular interface between IP, intellectual property, and the traditional medicine system. They have been equally taken over by the big pharma. The only word at the moment I can make, there also there is a huge challenge as far as is how to use them in sovereign way for the public health needs as well. Let me come to the second point, and very quickly and briefly, that is the regard to, is there an opening for actually, intervening in the world of intellectual property? That was the question which Anna asked, and I'm saying yes, there is an opening as far as it's concerned, and I think today I think yesterday there was a resolution put in WHO for discussion, and let's see what fate it meets. But it is basically aimed at voluntary pooling of medicines and therapeutics and vaccines, so that they are made they don't, while in the development of new therapeutics, we don't face as much barriers and litigation and so on, etc. It takes care of one small part of the problem, but an important part of the problem, no doubt about it. But voluntary patent pools are hardly a solution, because I showed you in the case of the even malarial case, we have had a medicine patent pool, but they have not gone very far as far as is concerned. And number one, not everybody is a member of such a voluntary pool. Not all firms submit themselves to that. We need to work towards a larger framework. And I suggest that a WHO declaration and in WTO, we should put it out also, that on pandemic, we should include elements like a recognition of the right of countries not to enforce exclusive rights under patents or other IPRs in relation to all present and future products related to the treatment and prevention of COVID-19 related morbidities. So the exclusivities go away, so that at the most you can pay royalties, at the most you pay fees, but you are not prevented from building your capacities in the healthcare systems to actually provide such vaccines and therapeutics. Such medical technology should be available for manufacturing and supply wherever needed, and there should not be restrictions. We had, faced a challenge of SEQS, that is the hydroxychloroquine, which has been recommended for health workers, and whether India produces a huge amount. And initially Trump needed it because he believed that that is the solution, though later we have found that that is also not effective as far as concerned. But since we are producing it, the first reaction of some of the people in the country and including of the government was, we will not give you SCQS. We said no. As the left, we believe in internationalism. We must actually produce more of SCQS, hydroxychloroquine. It was actually developed in a firm which is a person who worked on mercury, Acharya P.C. Ray, Praful Chandra Ray, one of our forefather of the Indian chemistry as far as is concerned. I would say this is a 100 years old work on which the chloroquine was built. Anyway, to cut the story short, I can see Francine saying that challenges there in terms of time management. Now let me just look at it. There is a 73B of the TRIPS agreement provision where we can suspend the enforcement of any IPRs as far as is concerned in situations where health alerts and emergencies are there. But this is not been allowed to be enforced in our country. And I think we should go to the TRIPS Council, we should go to the WTO, the WHO, we should adopt such a resolution saying countries must have right to ensure that products are available at affordable prices, free access should be there, or whether it's diagnostics, whether it's therapeutics. At the moment, liberalization has forced us to, in health products, become import dependent, whether it is the case of masks, whether it is in the case of Agnoletto was mentioning about the personal protection equipment as far as it's concerned. And, Italy was refused, and I know the kind of challenge that faced. We too have faced that particular challenge. We are dependent on, in the diagnostic kits, one of my paper which I can send to all of you is on, in vitro diagnostics, where we have reviewed how we became import dependent and how did that happen and why we could not become self-reliant. See, health system is one system in which we will have to have that selective delinking from the global value chain, which actually do not allow you to be, self-reliant. You can't deal with it. In the common goods perspective, your own challenges, your own need, you are dependent on the transnational corporations, profit motivations, having determined what the health system should look like. Our health system should look like as we need it, as the people's needs demand our healthcare system to be. In every country, there are own specific challenges, and each country has to take care of that. We developed a vaccine. The first vaccine which we developed during the post-independence period was actually developed a problem that came up in the forest of Karnataka, Kerala. Karnataka, Kerala have faced Nipah virus, they have faced Ebola virus, and at one time there was even a fear that the Zika virus also, Zika also, they will face it. There was a one particular virus for which a vaccine was developed altogether locally. and it was produced locally. So see, specific needs come up in every country. So as a result, you can't be dependent on the US or on any other country. The US spends, more than 73, accounts for 70% of the world's biomedical R&D investment. And let me not talk about it. What is it geared toward? It's not geared to yours and my needs or people's needs. It was geared to the needs of the US's own challenges at that particular point of time. But they determine the international collaboration priorities and so on. It's a vast subject in itself. How a pandemic influenza preparedness framework came up in WHO, and how it has been built on the commons good perspective rather than on the intellectual property. The way it required organizations and laws which needed to be created, etc. If you don't have, it can't be just norms based. You need to create organizations and laws for that. There are openings for that, and pandemic has given us not only crisis but also has given us an opportunity to intervene. Thank you.
Thank you so very much. I think with the three speakers, all the questions have been answered. So, and given the fact that our time is up, it's up for 15 minutes already, I think we can close here. I just would like to tell you that our next webinar is next week on Monday, the 25th. It is with, on the same, not exactly the same topics, but it is with Marisa Matias, who is a member of the European Parliament, who is from Portugal, and with other very interesting people. So I just recommend you to watch the website of Transform. The registration will be open very soon, I think, Roberto. So, and there will be a third webinar the week after, on the 1st of June. So I thank you all very, very much for your cooperation. I think this was a very interesting start. We had very good information and a very good discussion. Roberto, I do not know whether you have another message.
No, just to thank you, all of you, Armando, Dinesh, and Vittorio. And I hope we will find the way to cooperate again and to keep this relation helpful for the civil society mobilization that we want to arise in order to strengthen our relation, but also to have some change in the rule of the market. Thanks again, and see you soon. Ciao.
Thank you.
Thank you. Bye-bye.
Thank you so much.
Ciao.
Thank you.
Ciao, ciao. Thank you.
Thank you. Thank you very much.